Hello and welcome to the Introduction to Instrument-Assisted Soft Tissue Mobilization brought to you by HawkGrips, the leader in soft tissue therapy instruments and continuing education. This video will focus on the fundamentals and applications behind the technique Instrument-Assisted Soft Tissue Mobilization, also known as IASTM or IASTM. The purpose of this presentation is for the participant to understand appropriate use of instruments in regards to treatment edges and bevel position, recognize different treatment strokes and understand how they are applied to different body regions, and understand how to apply the appropriate IASTM treatment edge for specific soft tissue dysfunctions of the spine and extremities. IASTM is not designed to replace your hands or eliminate manual techniques, but rather to supplement your treatment. The instruments will provide the ability to provide force to a broad area or focus the treatment force to a small specific region. The instruments will also help to specifically identify tissue restrictions by increased vibration of the instrument during a treatment stroke when restrictions are present in the soft tissues. This amplification by the instrument will provide more efficient treatment by focusing on the specific tissue restrictions. Finally, the use of HawkGrips instruments for IASTM will place less strain on the therapist's hands, allowing more efficient treatment and less potential for overuse injuries. It is important to understand precautions and contraindications for treatment. Some specific precautions include an increase in symptoms, anticoagulant therapy due to the risk of bruising, treating over venous varicosities, and comorbidities such as diabetes and autoimmune disorders, chronic regional pain syndrome, and treatment over surgical repair sites during the early stages of healing. There are also a few contraindications to consider, such as patient refusal, localized infection, myositis ossificans, treatment over a fracture site, inflammatory skin disorders, osteomyelitis, thrombophlebitis, and over an open wound. The clinician must always keep the overall treatment goal in mind, as this will dictate force, duration, and intensity of the treatment. To treat acute injuries, to decrease swelling, or decrease hypersensitivity, it is generally recommended to use light treatment strokes. For chronic conditions, tendinopathy injuries, promotion of fibroblasts, or breaking of crosslinks, more firm treatment strokes are recommended. Now we will introduce the market-leading IASTM instruments developed by HawkGrips and briefly review instrument selection and use. Our live courses are designed to take the following concepts into much greater depth. HawkGrips, the leader in soft tissue mobilization instruments, offers 10 different instruments, available individually and in several sets. Made completely in the United States from solid surgical-grade stainless steel, they are available in a variety of sizes in order to contour to different body areas of various sizes. In addition to specially designed grips to reduce clinician fatigue and slippage, each tool features either a concave or convex treatment surface for ideal depth of treatment and patient comfort. Prior to beginning treatment, the clinician should always explain how IASTM can improve the patient's pain and function. Generally reviewing some of the previously discussed research can help the patient understand how beneficial the application of HawkGrips instruments and treatment can be. After receiving consent from the patient, the clinician now needs to consider what their overall treatment goal is going to be. Is the goal to decrease swelling, mobilize chronically restricted tissue, trying to stimulate fibroblast production, or to improve tissue perfusion? Instrument selection and implementation will all depend on this treatment goal. Prior to beginning IASTM strokes, the clinician should apply emollient to all targeted treatment surfaces. The emollient will help to decrease friction, making the treatment more tolerable. The treatment area will not only be limited to a specific area of pain. There may be tissue restrictions proximal or distal to the injury that can contribute to your patient's pain. There are a number of instruments designed by HawkGrips which are ideal for all treatment needs. As you will notice, the larger instruments are ideal for larger treatment areas. The smaller instruments are ideal for a more focused treatment. The convexity of the instrument will also affect treatment, with concave edges dispersing force and convex edges being more intense. The multiple instruments are contoured for different body regions. Each instrument has one or more specific edges called a bevel that are optimal for treatment. During treatment, it's likely that multiple instruments will be used. To understand how the instrument should be used, the clinician should understand a bevel. A bevel is the angle or inclination of a line or surface that meets another at any angle but 90 degrees. The direction of the bevel slope will yield different treatment results. Approximately 95% of the time, the bevel is used with an upward slope. This provides a more firm treatment edge, allowing the instrument to efficiently dive into the tissue, mobilizing deeper structures. Of course, different conditions require varying force. Therefore, the clinician should keep in mind the overall treatment goal. The bevel can be utilized with the bevel facing downward. This is used less frequently and is designed to provide a softer treatment. This is ideal for desensitization, mobilizing fluid, or conditions requiring a soft stroke. The bevel sloped downward is not ideal for deeper treatment. The treatment angle of the instrument can be modified to provide varying force. Typically, most assessment and treatment strokes will begin at an approximately 45-degree angle. This angle can vary between 30 and 60 degrees for the majority of treatment applications. The treatment angle will have an impact on the amount the instrument dives into the tissue. In general, the flatter the angle, the more superficial the treatment. One of the great benefits of precision-engineered HawkGrips instruments is the ability to identify tissue restrictions. When the tissue is moving efficiently, the instrument will glide effortlessly through the tissue. When restrictions are present, the clinician will feel the instrument slightly vibrate when passing through these structures. When restrictions are identified, the clinician will then use various strokes, which we will discuss momentarily, to improve mobility. Tissue restrictions can also be identified by an increase in histamine response and/or the patient's verbal and nonverbal response to treatment. The clinician needs to remember that treatment may be uncomfortable but should always be acceptable by the patient. There are times when a more aggressive force is needed, but should always be within the patient's tolerance. If a patient is not tolerating the force, the clinician can lighten that force, change the angle, change the bevel to be sloped downward, or change the instrument to either a larger instrument or one with a concave surface. The clinician also must remember to check various depths and not assume that deeper structures are mobile if the superficial tissue is moving well. Before we introduce the treatment strokes, we want to take a moment to discuss a revolutionary product developed by HawkGrips called HawkHydro. As discussed previously, an emollient should be applied to the targeted treatment area. Traditionally, practitioners would utilize an oil-based emollient. The major problem with these products, though, is the issue of infection control. Multi-use containers can harbor bacteria, potentially spreading between patients. HawkHydro has been developed to solve this issue. Because HawkHydro is water-based gel applied without an instrument, therapist, or patient contact, infection risk is greatly reduced. This specially designed emollient gel will also provide maximal friction reduction with a minimal amount of product. Oil-based emollient often will build up on the instrument, referred to as snow plowing, making the instrument slippery and difficult to handle. Hawk Hydro also eliminates this problem, resulting in consistent grip and instrument control for the clinician. Hawk Hydro is fragrance-free and is easily wiped off the skin with a cloth, eliminating residual creams on the patient's skin. It also comes in a small self-contained container, making it easy to carry in the clinic or on the field. One common treatment performed by clinicians is the application of athletic or elastic tape to help decrease muscle pain and enhance carryover of the treatment. Using traditional oil-based emollients makes the adhesion of tape nearly impossible. Hawk Hydro Plus easily solves this problem. An added adhesive polymer has been incorporated into the Hawk Hydro Plus formula. Hawk Hydro Plus will leave a gentle tack on the patient's skin. This tack will not interfere with the application of tape and will in fact enhance the adhesion, helping the tape remain throughout the athlete's sports or patient's daily activities. This allows the combined benefits of IASTM treatment with taping to achieve maximum results. We always want to clean instruments between each patient with a disinfectant cleaner and a soft cloth. While the instruments are made with surgical-grade stainless steel, the edges can still be damaged if dropped. Please take proper care of your instruments to ensure longevity of the product. We will now take a closer look at the various IASTM strokes. The first stroke typically used with patients is the scanning or sweeping stroke. Here, the clinician is utilizing the HG8 instrument with a two-handed grip. This broad stroke is designed to cover larger areas and help the clinician identify tissue restrictions. Typically, this stroke is passing parallel to the muscle fibers. Remember, identification of tissue restrictions is primarily achieved by increased vibration of the instrument. Increase in histamine response and patient reports are also utilized to identify these restrictions. In this video, also note the upward slope of the bevel on the instrument. With the bevel sloped upward, the instrument will dive into the tissue. In this video, the HG7 instrument is utilized to perform sweeping strokes. Notice that the clinician is focusing their treatment stroke one direction at a time. With close observation, you will note the strokes are unidirectional, always the direction the bevel is facing. This is the treatment stroke, during which time the instrument is engaging the target tissue. When returning the instrument back to the starting position of the next treatment stroke, the instrument can be lightly dragged across the patient's skin. You do not drag the instrument back and forth while engaging the target tissue with treatment pressure, as this can be uncomfortable to the patient. Sweeping strokes can also be performed with the HG1, 2, and 3 instruments. These instruments are ideal for larger muscles. The ergonomically designed handles and noticeable weight of the instrument makes treatment easy on the clinician and enhances patient comfort. Fanning strokes are ideal for crossing over muscle fibers. One end of the instrument should remain fixed and the other end of the instrument passes in a larger arc. The clinician, again, should only treat one direction at a time and consider the angle and slope of the bevel to specifically target tissue restrictions. In this video, both the one- and two-handed fanning strokes are demonstrated. The clinician, again, keeps one end of the instrument stationary as the opposite end moves through an arc pattern. much like a windshield wiper. After performing larger sweeping and fanning strokes, the clinician can utilize more specific, smaller strokes to further treat tissue restrictions. The brushing stroke demonstrated here with the HG9 instrument is performed in parallel with muscle fibers. The clinician needs to remember that the small instruments will provide much more focused treatment. Therefore, the force may need to be reduced for patient comfort. Strumming strokes are similar to brushing strokes. However, this stroke is utilized perpendicular to tissue fibers. This stroke is analogous to transverse friction massage. The instrument angle can approach 90 degrees, usually held around 70 degrees to the patient's skin. While the instrument engages the tissue, treatment remains in the direction of the bevel as with the other strokes. This stroke is particularly effective over tendon and ligamentous tissue. Framing strokes are performed around bony contours such as the patella. The clinician should perform treatment around these bony contours to identify and clear any tissue restrictions. Additional bony regions for consideration would include the fibular head, greater trochanter, iliac crest, medial scapular border, acromion, and radial head. The J-stroke demonstrated here is a take on the traditional myofascial stroke. This stroke is particularly useful in mobilizing tissue interfaces such as the IT band and the vastus lateralis, the erector spinae and the spinous processes, and the muscle belly interfaces of the extremities. Think of this stroke as a brush stroke with a hook on the end. It is important not to keep the instrument flat on the skin while performing the hook motion, but to lift the lateral edge of the instrument as if you were driving a car around a banked turn. This will assist in mobilizing or splaying the target tissue from the adjacent tissue. To review, the primary strokes are the sweeping, fanning, brushing, strumming, framing, and J-strokes. These are the basic key strokes utilized for all IASTM treatments. 2 live courses as provided by the HawkGrips educational team, each course totaling 8 contact hours. Level 1, Fundamentals of IASTM, will focus on introduction of these strokes and acquisition of motor skills for the clinician to integrate these techniques into patient treatment. Using patient case scenarios, Level 2, Advanced IASTM, will allow the clinician to master these strokes as well as additional advanced strokes to maximize patient mobility and increase function. Also, we include adding patient motion during treatment to enhance outcomes in this live advanced course. Level 1, or a comparable 8-hour introductory IASTM course from another company, is a prerequisite for taking the Level 2 course. Thank you for your time. If you have any questions prior to the live course, please do not hesitate to reach out to our education department.